Jenny McCarthy Show on Sirius XM Stars.
Things are going to start happening to me now.
Welcome back to the Jenny McCarthy Show. I'm Jenny McCarthy Wahlberg. You guys, later on in the show, I want to hear from you. You're going to call in and tell me, let's talk Christmas presents. I haven't even started yet. Like, what do we get our kids? What is that new toy that everybody wants? What do you get your husband? What do you get your wife? What you shouldn't get your wife. Ladies, right? Call in and tell the guys this. So I want to hear from you guys a little bit later. But right now, let's talk about something a little, not even a little, seriously serious. Heart disease is the most common cause of death in the United States. 1 in 4 women die from it. I can't even believe that number. Yet, it is extremely underdiagnosed in women, as they tend to have atypical symptoms and can have a heart attack without chest pain. The 2 most common forms of heart disease that affect women are coronary microvascular disease, also broken heart syndrome, which I find still such a fascinating, real thing. Dr. Schwarz is joining us today. Hi, Dr. Schwarz. Welcome to my show.
Oh, hi. Good morning, Jenny. Thanks for having me on.
Wow. So could your fatigue be a sign of heart disease? That's what we're going to talk about. How often does it happen that women ignore their tiredness and it's actually that, we have a heart condition? That's the issue?
Well, all the time. I mean, the number one syndrome or symptom which brings especially women into our offices as cardiologists is actually that women tell us, Doctor, I really feel tired. I can't do what I want to do on a daily basis. I feel really lack of energy and fatigued. And often it's not really taken serious enough by many healthcare providers or by the patients. But keep in mind, there can be several reasons for that, including heart disease, as you mentioned.
That's scary because I feel like one of those people where I'm like, sometimes I can't get out of the bed. So is it sometimes, is it something that happens to women like, hey, doctor, I haven't been able to get out of my bed for 4 months? Or is this something like here and there?
Well, it's all of the above, if you wish, Jenny. Mostly we hear that women throughout the days lose more of her energy much earlier, meaning they start the day. It's not typically that they think, I can't get out of bed. They start the day, but after maybe half an hour being up, they feel really tired. They feel really tired when they go upstairs in their house or when they do their dishwashing or their groceries, moving around and stuff like that. So the simple things of the daily life become difficult, and that for us as physicians or especially as cardiologists is always considered a warning signal, and it could be caused by lack of oxygen in the heart or in the brain caused by the heart.
Okay, when I did my genetic testing, I came up for a marker for heart disease, and my doctor said, okay, we're going to keep an eye on it. So basically every year I get an EKG, it comes back normal, and then he checks my cholesterol, and he says, as long as these all like certain boxes are checked, I'm not worried. Now, is that a way to test it, or is there something more I should be doing?
Well, absolutely. Again, it depends on the symptoms, but also on the risk factors. And you're absolutely right, Jenny. A positive family history or genetic markers indicated for heart disease or coronary artery disease have to be taken very serious. So not everybody should get every test on earth, of course, but if there are certain risk factors and certain symptoms, and fatigue is one of those, and positive genetic testing is another one, or a family history of early heart disease is another one, then an EKG and the physical examination are the first step, but it's by far not enough. In those cases, we do recommend to consult a specialist, meaning a cardiologist, and oftentimes they do very simple non-invasive tests such as an echocardiogram, which is an ultrasound of the heart, which gives us a little more information about the function and the strengths of the heart, especially to rule out something like heart failure, and or a simple stress test, which could be like on a treadmill, like you do in the gym, to make sure there's no signs for lack of oxygen in the heart.
Okay, so the echocardiogram is different from an EKG?
Absolutely. An EKG is just an electrical representation of the electrical stimulus of the heart. The echocardiogram shows us actually in 2 or 3D pictures the contraction of the heart, the valves. We see how strong is the heart, how good is the relaxation of the heart, is there anything wrong with what we call regional wall motion abnormalities, is there any signs for an inflammation or infection of the heart muscle, and so on.
Now, you know, we're talking about fatigue and exhaustion being a sign of heart disease, and I don't want every mom or women out there to go like, I'm tired all the time, because we're balancing 100 million different things. What are some other symptoms, warning signs we could feel?
Yeah, as you mentioned, Jenny, the problem for us as physicians is there's a lot of atypical and non-specific symptoms, much more in women than in men, and that's the reason why heart disease in women is often underdiagnosed or late or too late diagnosed. So oftentimes the typical chest book symptoms like chest pain, we don't see that frequently anymore. We see much more things like fatigue, as we mentioned, insomnia, problems to sleep, memory issues, doctor, I can't concentrate. We see weight changes, either weight loss or weight gain. We see breathing problems with simple activities of daily life, even like brushing my teeth. Doctors, I can't breathe well afterwards. That's very alarming, but very non-specific, meaning it could mean anything or nothing. But in cases like this, keep always in mind heart disease could be one of the reasons. It doesn't have to be in all the cases.
You know, Rosie O'Donnell did a really good job coming out in public and discussing her heart issue. And I guess she had a minor heart attack. And she said that she just felt tired and got into bed and she thought she had the flu. She said it actually felt like she had the flu. Does that make sense?
Absolutely. Like I said, in women especially, there's more non than specific symptoms. Flu-like symptoms, weakness, breathing issues, sometimes pain in the stomach region, which is misdiagnosed as, this could be gastritis or from the gallbladder, can give us some hints and can be caused as well by heart disease.
Now, what does a heart attack in a woman look like on the outside? Like, could a friend notice another friend having a heart attack?
Well, that's very difficult without, of course, diagnostic equipment. I mean, in general, any change from a prior condition is suspicious for any disease, of course, and that's the definition basically of an organ malfunction. But it's almost impossible to distinguish without certain technologies or experience whether someone has a panic attack, whether someone has a clot in the lungs, which could be life-threatening, whether someone has a heart attack or a ruptured aorta. So there's different conditions which could be harmless, but also could be extremely life-threatening acutely, and they can present exactly in the same ways. So we have a lot of people who tell us, oh, doctor, my heart is fluttering because of 1 or 2 skip beats. But others say, oh, doctor, I feel relatively good to just have a little strange feeling in the chest, and they still could have a severe heart attack.
So no matter what, we need to get looked after. We need to go to make our doctor's appointments once a year and stick to it.
Absolutely. And if you don't get the right diagnosis or if you feel that something else should be done, then just talk freely to your healthcare provider and your doctors and say, maybe I should see a cardiologist and look a little further to make sure nothing is missed. Because the problem in women is the diagnosis is made way too late.
Right. And way too late, you meaning heart attack, death?
Well, that could mean it. In a third of the cases, people not even make it to the hospital, and afterwards it turns out, oh, yeah, she didn't feel well for a while. We should have gone earlier to the doctor, but then it might be too late.
So is heart disease a death sentence, or you can reverse it?
Well, that's a very difficult question, Jenny, but it is, in most cases, not reversible. There's conditions like inflammations of the heart muscle, like virus-induced myocarditis cases, which could be completely reversible. But what we are talking about usually is coronary artery disease as a result of calcification of the blood vessels in the heart or heart failure. And these conditions are not curable, so they are chronic conditions. But nowadays, keep in mind, we have technologies and medicines and drugs available so that many people, even with those conditions, can live up to 100 years if they follow the rules and if they're on the right medications and are followed up frequently.
That's the thing. Now, I know a lot of people with heart murmurs. I myself have a tachycardia I've had it since I was born. I remember being 4 years old telling my mom something's wrong with my heart because it would always go like for about a minute and a half from time to time. If I got up quick, if I turned around, those aren't necessarily signs of heart disease, correct?
Well, keep in mind there are three things in the heart, among others, we are looking at. Number one is the mechanical function, the pumping, basically, which represents the strength of the heart. So if that doesn't work, that means heart disease. Number two, we look at the plumbing, meaning the oxygen supply. And if there's a problem, that means you usually coronary artery disease, which can lead to heart attacks. And number three is the electricity of the heart. And that's what obviously you mentioned for yourself. There could be extra beats or episodes where the heart is fluttering or racing or a little bit irregular. That has nothing to do with the first two conditions I mentioned. It can be completely independent, and in some cases it's dangerous, but in the majority those arrhythmias are relatively harmless. Some need treatment, others don't.
Okay, that's good. And now what do hormones and thyroids play in all this? So many women have hypothyroidism, and I don't know why, but every woman I talk to that's in their 30s or 40s have hypothyroidism. But talk about why hormones and thyroid play in all of this.
Well, the whole human body is basically an equilibrium of interconnections and interactions of all the different systems, as you know, in particular the endocrine system. So the thyroid gland controls the metabolism, controls part of the heart rate, controls many other functions. So if we lack thyroid hormones, certain conditions of the heart can occur. If we have too much thyroid hormones, and the same thing can happen. So the heart often races too much. There could be effusions around the heart if there's not enough hormones, and so on. So often the heart can also be like just a result of another condition. So if the thyroid hormones are out of balance, that can affect the heart. The same with the sexual hormones, by the way. Too much of growth hormones, not enough growth hormone, problems in the testosterone levels, all can affect the heart in different ways. And all this needs to be ruled out if you have a thorough cardiac evaluation and examination.
You have done such a wonderful job breaking this down for us to understand. Dr. Schwarz, I really appreciate it. For more information, his website is drernstschwarz.com. Thank you so much for enlightening and educating us today. I really appreciate it.
Thank you so much, Jenny, for having me on. All the best to you.
You too. All right, guys, be right back with some weekend audio. SNL, funny stuff.
Girl, you're my special lady, and I love you real hard. And I want you to remember, it's okay that you got that very special scar. I like your tush, please grow out your bush, cause your body natural is a fucking A+. Your birth and battle wound ain't no imperfection. It's every part of you that causes my erection. Tonight I'm gonna make love to all of you. So prepare your sweet love hole for a most passionate scroll. Cause when I see that C-section on you, oh girl, you know our love will make it a wee section for two. I like that smile below your belly button. It's like a welcome sign on your sweet love muffin. Don't be shy about that little C-section now, cause it's about to meet my big D-section. Wow, your vagina's like a farm field that I wanna plow. If that is something you would so graciously allow, my field of dreams near your Caesarion. If you build it, I will come. Tonight I'm gonna make love don't make it a wee section for two.
The Jenny McCarthy Show would like to take this time to remind you to clear your browser history, especially if you're on a work computer.